Hello, and welcome everyone to this presentation titled Impact of Intrinsic Factors and COVID-19 Pandemic on the Use of Technology. My name is Alasara Alekra, and I am a senior lecturer at Information Systems, Karlstad University in Sweden. This work has been done with my colleague Agnieszka Kitkowska, and today I will be presenting a brief account of our work. The ongoing coronavirus pandemic, known as COVID-19, has affected our lives in many ways, from social isolation and remote working to managing our well-being in everyday living. Apart from the risk of being infected by the COVID-19 disease, indirect risks to one's health are a consequence of restrictions enforced due to the COVID-19 pandemic. According to the World Health Organization, health is defined as the state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. People everywhere are limiting their social interactions, working from home, and avoiding unnecessary gatherings at the very least. Such limitations to current lifestyle, alongside the reduction of physical activities and encounters, do have consequences to the overall well-being. ICT information and communication technology has played an important role in facilitating activities and providing services for communication, learning, entertainment, and health purposes. In our study, we investigated people's perspectives on the role of technology during the pandemic of COVID-19. Therefore, our research questions are: 1, what are the effects of COVID-19 on technology usage by participants? And 2, what intrinsic factors, such as health consciousness, perceived isolation, concerns about tracking and pandemic, contribute to changes in the use of technology in different contexts? In our empirical investigation, we used an online survey. The survey contained questions about technology use pre-pandemic and during pandemic. The context of using technology that we inquired about were for work, gathering information or education, entertainment, health, and communication. We also measured perceived isolation, loneliness, and social support, and health consciousness. We included an open-ended question about COVID-19 and its impact on technology use and potential self-reported behavioral changes. There were 218 responses in total, including the 72 who responded to the open question. The average completion time was 4.4 minutes. Our survey results show a significant increase in technology use in all investigated contexts, mostly in work and communication contexts after the pandemic occurred. Perceived social isolation, concerns about the pandemic, and tracking of COVID-19 are the intrinsic factors which have the most prominent influence on different use of technology. It seems that using technology for entertainment could be a coping mechanism to counteract loneliness and mental health effects of COVID-19. Our results imply that pandemic concerns might increase the use of technology for work. However, a high level of loneliness might push people away from it. This might be interpreted as a signal that loneliness could potentially decrease work and productivity. It is important to consider the long-term effects of loneliness and prolonged isolation on mental health. As for our qualitative results from the open-ended question, 3 main themes were highlighted. 1 is beneficial opportunities. Example is increased productivity and learning new technologies. 2 is concerns and consequences. For example, loneliness and extended screen time. And finally, 3 is behavioral transformations and adaptations due to COVID-19. For example, constant use of devices and dependency on online shopping. This concludes the presentation of our short study. Thank you for your attention. And now we can answer your questions.